I want to talk about coping skills in the immediate. I want to talk about what you can do when you're faced with a situation where you want to use, where you're faced with a situation where you're tempted to use. And I want to frame it up around two different styles of therapy, or two different ways of approaching therapy. One is called cognitive behavioral therapy, and the other is rational emotive behavioral therapy. They're both based on the same type of process. They're based on this idea that thoughts lead to feelings, lead to actions. So it's all about our thinking. It's all about this idea of trying to identify our faulty thinking, our irrational thinking, and replace it with more realistic, healthy, positive thinking. So I'm around my friends. I've been I've been in recovery, for 6 months. Been doing really, really well. Kind of come home for the weekend and I run into some of my friends and they ask me if I want to go out. So I go ahead and I tag along and I go to the bar and they're drinking and they offer me something and I'm kind of stuck in this moment. And I start to think to myself, man, this would be pretty fun. I start to think to myself, what's the big deal? I'm just going to have one drink. No problems. This won't be a really big problem at all. Nobody will know. And you know what? I'm not even sure that I have an alcohol problem anyway. Now, I'm not here to debate whether or not you do have an alcohol problem or not. If you're there where you're not sure what you got going on, explore that. But let's assume that that you do have an alcohol problem. What you want to do is you want to replace that fantastical thinking, which literally that's what it is. It's a fantasy that this will just be one night. I'm just going to drink. It's not a big deal. Replace that with a more realistic outlook on what's going to happen. In the recovery rooms, they call this play the tape the whole way through. So rather than just go with that impulse, that feel-good impulse, actually think to yourself, what's going to happen if I take this drink? What's my wife going to say? What's my mom going to say? What's my dad going to say? Am I actually going to only take a drink, or am I going to want to continue after I take this drink? Is it going to lead to other drug use? Maybe even think about other types of long-term consequences and other reasons and motivations for not taking that drink. The most important part of this conversation, guys, is you have this impulsive, in-the-moment thinking that may not be good for you, and you have the ability to recognize it and replace it with a more realistic thought pattern. Because you've entered into the recovery process, because your brain is kind of cleared up, because you're coming back online, you've given yourself a chance to make a better decision. So keep this in mind. And again, I want to emphasize, reduce environmental triggers. Don't put yourself in tempting situations. But if you find yourself there, think it through. All right, we'll see you soon.